If you're planning on taking the OET speaking test in 2025, then this video is for you. I'm going to break down everything you need to know so that you can walk into your speaking test feeling calm, confident, and ready to pass. In this video, I'll cover what to expect, how to prepare, and how to ensure you perform your best in the role play. So let's start with an overall introduction. What exactly is the OET speaking test? This consists of 2 5-minute role plays which are specific to your medical field. For example, if you are a doctor, you will be playing the role of a doctor and you'll be dealing with a patient or patient's caregiver in a consultation type situation. The test starts with a quick 2-minute warm-up with your interlocutor. This part of the test is unassessed, and the purpose of this is for you to warm up, start thinking in English so that you can feel confident for when the role play begins. The interlocutor will then hand you your first role card and you will have 3 minutes to read the card and prepare your answer. During this stage, you are allowed to take notes. The role play will then begin, lasting 5 minutes, and you'll be expected to interact with the patient and run the consultation just as you would in real life. Once the first role play is complete, you will repeat the process with a second role card. Doing 2 different role plays really helps you to demonstrate your language skills so that the examiner can see how you would deal with these different situations in real life. Now, the OET speaking test is designed to feel as real as possible. You will be dealing with a patient or caregiver, and you will be expected to respond to the situation just as you would if you were really at work. So it's important to keep this in mind as it can help you to feel more relaxed during the role play. Remember, at the end of the day, this is your job. You already know how to handle these situations. So all you have to do is relax, be aware of the assessment criteria so that you can demonstrate the appropriate skills, and enjoy showing the examiner exactly what you can do in English. Now let's talk about how to prepare for the speaking test, as preparation is key to your success. During the role play, you'll be assessed on your ability to gather and provide information, build a relationship, and show empathy with the patient, among other things. So here are some ways you can ensure that you are ready to demonstrate these skills to get a high score. First, make sure you understand the exam format and assessment criteria. Spend plenty of time looking at sample role cards so that you know what to expect, and make sure that you have studied the assessment criteria in detail. Look at each individual one, ideally with a teacher, and make sure you know how to demonstrate all of the skills detailed in the descriptions of the criteria. Next, practice is essential, and it will be even more effective if you can do this with an expert OET teacher. Do plenty of role plays with your teacher so that they can then give you feedback on your areas of strength and the areas that you need to work on. Remember, the only way to improve in any area of the OET exam is to know exactly where you're going wrong and how to improve. Finally, make sure you don't rush the process. Exam preparation often takes time, so make sure that you slow down, give it the time that's needed, and always take advice and guidance from your teacher, who will be able to tell you when they think you are ready to perform at your best and get the high score that you need in the OET speaking test. Let's take a look at an example OET speaking role card now. So this is what your role card will look like. It will say the profession at the top, in this case nursing. It will then say the setting, so that's the place that the consultation is happening. It will then have your role. In this case, it is nurse, and it gives you some background to the patient. It usually gives their age, any conditions that they have, and their reasons for coming in to see you today. You will then see your task below with several bullet points. It is your job to make sure that you go through all of the bullet points on the card. It will require you to explain information, reassure the patient, gather information, and also emphasize important points. It's very important that you spend some time during your preparation looking at plenty of official OET role cards so that you can get used to the format and understand exactly what's required of you. My next piece of advice is to ensure you use the preparation time at the beginning of the role play very carefully. Remember, after being given the card, you will have 3 minutes to prepare. So here are some things that you should do during those 3 minutes. First, read the role card very carefully. Make sure you understand the situation. Who is the patient? What are their main concerns? And how might they be feeling? Remember, in the role play, you will be expected to show empathy towards your patient. So you should identify if they are, for example, feeling angry, worried, nervous, or stressed. This will allow you to respond appropriately and handle the situation well. Next, plan your approach. Use this time to structure your thoughts and think what types of questions you will need to ask. You will be assessed on your ability to gather information, so it's a good idea to think about what types of questions you will ask and at which points during the role play. You should also think about how you might need to explain certain terms or concepts in layperson's terms that your patient can understand. Remember, you're not going to be speaking to another healthcare professional, so it's important that you use appropriate language that your patient can understand. Finally, note down any key phrases that you're planning to use during the role play. Empathetic phrases such as, "I understand your concerns," or "I see this must be very difficult for you." Keep those in mind and note them down if you think you'll need a reminder to use them during the role play. So this preparation time is very important to mentally prepare and rehearse what you're going to say, so do make sure that you use that time wisely. Once the preparation time ends, it's time to start the role play, and this is where you'll need to start demonstrating your language and communication skills. Keep the following points in mind to make sure you get a high score. First, open the conversation. It is up to you to start the role play. If you already know the patient, then you can start by greeting them by name. If it's the first time that you're meeting them, you can politely ask them what they would like you to call them. Make sure that you give a brief introduction to the purpose of the consultation and then get started. The next thing you'll want to do is start asking questions. At the beginning of the role play, it's usually a good idea to ask open questions to gather general information on the patient's situation. You will then need to move on to closed questions to gather more specific information. An example of an open question that you would ask at the start of the role play could be, "Can you tell me a little bit about your symptoms?" This gives the patient the opportunity to elaborate on exactly what they're feeling. A closed question might then be needed to gather more specific details, such as, "Have these symptoms been getting worse?" Or, "Do your symptoms wake you up at night?" For these questions, the patient will simply answer yes or no, which will allow you to pinpoint more specific details. Next, make sure that you are responding actively to the patient. Demonstrate that you're listening by using active listening techniques, such as nodding your head or making reassuring noises such as, "I see." Remember as well that you are expected to show empathy, so don't forget how the patient is feeling and respond appropriately. Next, ensure that you organize the information effectively. When it's time to explain a process or give some information to the patient, do not give too much information in one go. Pause occasionally to check that the patient has understood you, just in case you need to repeat something. At the end of the role play, make sure you end on a reassuring note. Summarize any important information that the patient needs to take away from the consultation and check once more to see if they have any questions. So that is just a brief overview of the OET speaking test and some things that you need to keep in mind. Now let's summarize what we talked about with the OET speaking checklist. Number 1 is to ensure that you prepare thoroughly. Work with a teacher, get feedback on your skills, and work on the areas that you need to improve. Number 2 is to use the warm-up at the beginning of the role play to relax. Remember, this 2-minute warm-up is not assessed, so it's a chance to get you thinking in English and ready to perform in the role play. Number 3, read the role card carefully. Understand the situation, the patient's concerns, and how they might be feeling. Number 4, begin with a professional greeting. Make sure that you are ready to take control of the consultation and begin the role play appropriately. Number 5, ask questions to gather information. Make sure you know when to use open and closed questions throughout the role play to get the information that you need. Number 6, show empathy. Listen and respond to your patient and make sure that you acknowledge how they're feeling. Number 7 is to present information clearly. Use useful signposting phrases and don't give too much information all in one go. That leads me on to number 8, which is to check information. Make sure you pause every now and then to check that your patient has understood what you're telling them. And number 9 is to end the role play by summarizing and checking to see if your patient has any more questions. Following this checklist will help you stay calm, focused, and organized throughout the role play. If you follow the steps outlined in this video, you'll be able to show the examiner that you can handle professional consultations in a medical setting with ease and confidence. If you're looking for more personalized guidance to help you in your OET preparation journey, then why not book a free consultation call with our student success team? This will give you an opportunity to really pinpoint your strengths and weaknesses, work through our expert advisors to create a personalized study plan just for you, and get some tips and advice on proven strategies that have already helped thousands of students pass the OET exam on the first attempt. Get some clarity and feel confident about your OET exam preparation and book a call with our team today. All you have to do is click on the link in the description below this video. Thanks so much for watching, everyone, and happy studying!